the first slide. Here is back of trouser.
What are the uses of it? Where do you use it? Uses.
So in most of the poses you can see there's a ratchet block. So it's a very few poses like snap poses and ovum poses. Most of the poses will be having ratchet block. Okay. See near the handle. Between the handle and the blades, the running point is known as shank. So uses are used extensively in previous realization to hold the tube, to hold the vas vasectomy, to hold the appendix, to hold any tissues in malignant trauma, and urea in radical hysterectomy also can be used.
So in yesterday also the same thing was displayed. So any tubular structures to hold to use this back of process. Next, let's go to the next. I ask.
Okay, in this instrument, the lower end of both the blades are blunt. Among them, one of the blades is slightly narrow and slightly more sharp than the other one. The other one is slightly more broader and more blunt. It's used for giving episiotomy.
So what should be the angle of episiotomy? So I'll let you know. Because then we don't give it chocolate. We have patience. Anybody can volunteer for this?
Points retractable.
So in what surgeries where do we use noise retractor?
So mostly abdominal hysterectomy, like LSCS, maybe using this.
To retract what?
Abdominal.
Not for the abdominal wall, mainly to protect the bladder. When you are doing any abdominal surgeries, to protect the bladder, you use groin retractor. Next. So where do you use it?
So it's used for hot clamping. So also hot clampers, there are some fingers you have to give some 3 cm space to hot and clamp.
Little bit longer. Should give a little, not just 3 centimeters. At least 6-7 centimeters you have to.
So in this green umbilical process, you can see the lower end is flat, and you can see the serrations over there. It's also known as green umbilical hemostatic process. Not this.
So where do you use this?
Process use the lower segment cesarean section. Its functions are hemostasis and to catch hold of the margin so that they are not missed in future. It cannot be used for causing cesarean section.
So it is mainly used to hold the angles of the uterus when you do a lower segment cesarean section. And how many is needed when you are doing cesarean section? How many green umbilical is used? Minimum? How many you need? You know? 2 you will hold the angles and the margins. So at least 6 you will need. So where do you use the implant current?
By irrigation uterus, activation of vesicular node, and to remove any eating cancer basic postpartum hemorrhage to control complications of the pregnancy. And the curate, there are blunt curate and sharp curate.
Go to the back. Show them which is the blunt and which is the sharp. Louder. This is?
So left side is blunt and right side sharp.
So the one which is little thicker is the sharp, blunter one, and the one which is little on the other side thinner, that is a sharper. So sharper you shouldn't use in a pregnant uterus. Okay, you'll be causing damage. Next.
That's a small contribution as a valve. And how to differentiate?
Because even he's got confused after putting the slide. See this, the first one where you see, the first slide, there is some angulation, it's not straight. So that is valsalum. The other one is the Alice. Alice, it has a straight stem. So how do you, where do you use this? Is in vagina when you have to catch hold of the cervix. The vagina is not straight, right? When you put, so according to the angulation of the vagina, you have the valsalum. Whereas this Alice you don't use it as such in vaginal examination, just mainly to hold with the things, with the tough structure like rectus and okay, so that is the difference.
Another point is valvulum is slightly longer than the Alice and valvulum is shows concavity upwards.
That is the curve that next. What is this? What is
Outlet forceps.
release outlet force?
Other things like uses they are used only when the represent outlet. The only functioning moment while using these forces is the extension of the head. There is no need for anesthesia except local compression anesthesia. Episotomy, they are used to prevent mother from fearing during labor.
So this is mainly to cut short the second stage of the labor. And also if there is any distress, if you have to do the baby, if you have to deliver the baby soon and resuscitate, even in those conditions you use. Okay, next. What is this? Yesterday also this was shown.
Spongiodal forceps.
Next. What is this?
Elastic cup for vacuum extraction.
So where do you use that?
Delivery of baby.
No, in every delivery we don't use. Where do you use?
Instrument delivery for assisting in delivery by creating vacuum, then vacuum is taken.
Again, if there is any difficulty in delivery, if there is any distress, you have to extract the fetus very sooner, then you use it, just to cut short delivery. And one more question, can anybody answer what is flexion point? So at which point you apply the cup? Flexion point, anybody knows? You know what is flexion point?
So it is not actually quantilar, it is anterior to the 3 cm from the posterior quantilar.
Anterior to the
Posterior quantilar.
3 cm or from the anterior continent it is? So it is either 6 cm posterior to the anterior continent or 3 cm anterior to the posterior continent. It is like that. 6 cm and 3 cm. Police valve. This everybody. You tell the uses.
So to pass periurethry, intention of urine many cause. So we use it right from EMT to all departments. It's a very most common device that is police catheter. It comprises of you can see there is a balloon part, there is a urinary output part, there is a balloon which is inflated, and the tip which contains opening through which the urine flows. The inflation is because it prevents it holds the urinary bladder properly so that it doesn't come out, and it uses in sonosalpingogram to check for fetal patency and to gram.
In obstetric, where do you use?
Antibiotic hemorrhage or preterms or postpartum hemorrhage.
Why do you use it?
Because urine is ability to pass urine.
No, not all patients have retention. Mainly for output monitoring you use. Catheter is in case of postpartum hemorrhage. And in any other condition? In a pregnant female, when do you catheterize? Not before LSCS, any other condition? Induction of labor. What is that called as? Foley's induction we do. So even in that you use Foley's catheter for the induction. Next.